Today we're going to be talking about lifespan development, and it's in Chapter 7. The reason why we're going to cover this chapter is due to the fact that all patients have different vitals of different age groups. Neonates will be extremely fast, where a geriatric or a 20-year-old will be at a normal rate of 12 to 20. As you can see, it would be hard to assess a patient if we are not knowledgeable about their vitals at that age group. As you can see, I've jumped over the competency of the National Registry, what they really want you to know, so you can review those in your PowerPoint. But we're going to talk about vital signs of neonates. As you can see, a neonate is basically 1 month to 1 month to a birth to 1 month, and a infant is 1 month to a year. As you can see in this PowerPoint, that the pressures and the pulse rate and the respiratory rate are extremely fast, of 90 to 180 beats per minute, and respiratory rate's going to be 30 to 60 breaths per minute. Just remember, shortly after birth, pulse rate drops to 100 to 160 beats per minute, and respiratory rate slows to 25 to 50. So as you can see, it is extremely fast compared to a 20-year-old, which would be 12 to 20. By 1 year, respiratory rate's going to slow even further down to 20 to 30 breaths per minute, and it's going to come in more in line with a older child. As you can see, in neonates and infants, it's hard to get a blood pressure in the field because of the size of their arm. So basically, we go by signs and symptoms, basically, of their skin color. If a baby is pink and alert, we are considering them to be in pretty good shape. As you can see, a neonate usually anywhere from 6 to 8 pounds when they're born, and they usually grow about one ounce per day. Weight usually triples by the end of the first. The cardiovascular system at birth, usually they are being perfused by their mother before birth, and they make this transition from into their own circulatory system when they are born. It may take up to 24 hours. Pulmonary systems, infants younger than 6 months are prone to nasal congestion. How many times have you ever seen a little kid run around with a snotty nose? This is what we're talking about. Just remember, the infants have a larger tongue proportionally to their body, and their airway is very tiny. So airway obstructions can occur, and it's less common in older children and adults because of the size of the airway. If you can consider looking at a straw, that would be about the size of their airway. As far as their nervous system goes, they have certain reflexes. The moral reflex, which basically the neonate opens his arm wide and spreads his finger, and it seems like he's grabbing things. The palmar grasp occurs when an object is placed into the neonate's palm, and he actually grabs a hold of that object. Rooting reflex, neonate instinctively turn head when something touches his cheek. And of course, the suckling reflex occurs when a neonate lips are stroked and they think that they might be getting fed. Neonate has a soft spot, also known as the fontanelle, and at birth they have two fontanelles. One is posterior, which means towards the back, and the anterior one towards the front. And they usually, the posterior fuses after about 3 months. It comes together, and the anterior fontanelle fuses between the age of 9 and 18 months. Infant immune system maintains some of the mother's immunities, so at this, as you can see, they are protected basically by their mother's immune system for a period of time. And as you can see in this demonstration, or this picture of basically where the fontanelles are at the time of birth. And if you look at Table 7, you'll notice the characteristics change vary by the ages, basically months. As the child develops, you can read these just as well as I can tell you about them. And as you can see, crying is the main method of communication when they're young. Either they got a wet diaper, they're hungry, that they need something. So that is their method of communication. Just remember, infants develop relationships with their parents or caregivers at different rates in time. you'll understand this more when you actually associate with a child. Bonding is based on security of attachment to the parent or caregiver. They form a bond with this patient. The anxious avoidance attraction is found in infants who are repeatedly rejected, and you'll see this a lot out in the field where a child is really not wanted and they have this anxiety from attachment and find themselves not responding equally to each person. Separation anxiety you're going to see mostly in your older infants where they don't like to be away from their caregiver, their mommy or their daddy, and they have anxiety from that. They don't like to be separated. Trust and mistrust involved in an infant's need are being met. It's kind of like a puppy dog. If you don't take care of it, you don't feed it, they do not trust you as well even at this state. Now we're talking about toddlers and preschoolers. These are usually 1 to 3 years of age. As you can see, their vitals are starting to change, 90 to 150 beats per minute with their respiratory rates, 20 to 30 breaths. As you can see, everything is slowing down, and as you can see, as we progress through this, everything will slow down and progress into what we call an adolescent state. Systolic blood pressure is usually between 80 and 100 millimeters of mercury, and they usually have a temp between 96.8 to 99.6. They start getting a temp over that, you're going to possibly see febrile seizures. So especially when they get up to 100 and 102 or even 103 on their temperature, and you will see a difference in the child. Preschoolers 3 to 6 years of age. As you can see, pulse is slowing down, 80 to 140, usually going to be around 100. Respiratory rates 20 to 25 breaths per minute. As you can see, their lungs are getting more developed and larger so that their breathing rate slows down. Systolic blood pressure is going to be between 80 and 100 millimeters of mercury, and this is the age group that is kind of fun to be around. They really are attracted to their parents and the community around them. Also at this age group, you're going to see a weight gain should level off. Passive immunity is lost, basically, and what they're saying here is the immunity they have sustained from their mother is lost, and basically they're going to acquire immunity from various germs and viruses after they've been exposed and actually develop an immune system to this. Their neuromuscular growth also is considerably progressive at this age. Basically what they're talking about here is they're getting more developed and actually move around and run and play and know a few things what's going on. This is age 28 months is usually when they are completed toilet training. They don't use the pull-ups, they don't use the diapers. Usually they're pretty well can take care of themselves as far as going to the bathroom. Also at this age group, they learn to speak and express themselves. They'll throw little tantrums if they don't get what they want. You take them to the store and they see a toy on the shelf. This is basically where they're going to express themselves, and basically not always the best age group. You've always heard of the terrible twos. This is basically what we're talking about here. They do start mastering their basic language. They like to interact and play games with other children, and this is where you're going to see a little bit of competition come into play. They begin to understand cause and effect. If I do this, I'm going to get a spanking. So they do understand cause and effect, and they start to learn the difference between the different genders, and they start also looking at role models. As you can see, 6 to 12 years of age, vital signs are starting to approach more in the adult age range. Pulse is usually 70 to 120, usually around 80 to 90, and their respiratory rate's going to be dropping down to 15 to 20 breaths per minute. And their systolic blood pressure is 80 to 100 millimeters of mercury. As you can see, they're starting to approach that adult age group. and things are slowing down as their vitals, but you still need to understand that even at this age group, it depends on the patient itself. Obviously, physical traits and the body functions change become apparent. As we can see, they usually grow to 4 pounds and 2.5 inches per year. This is when they start losing all their baby teeth and they start getting permanent teeth to come in. This is where you're going to see the snaggletooth kid. Brain activity increases on both left and right hemisphere of the brain, and they're going to develop some of their own aptitude. At this age group, also, you're going to see these children are going to start doing things to avoid punishment and getting what they want. They may do something wrong, and they might start to tell little white lies to avoid getting in trouble. And also, you're going to start seeing them look for approval from their peers. Daddy, look what I did, or Mama, look what I did. And even in the society that we live in, teacher, look what I did in class today. And children start to make their own decisions, usually guided by their conscience, and also by the values that their parents have instilled in them. They are like to be and they like to be rewarded for what they have accomplished in their schoolwork, in building something, or displaying something to the parents or the guardians, or even to their teachers or their peers. All the years of adolescence. This is the time of life when they think that they're adults, that they're actually not. Females go into their menarche, which is their first menstrual cycle, and the males, they start growing. As you can see, their vitals are basically the same as you would see in an adult, and they are usually fairly athletic and can run, can do things that everybody wants to do as they get older. Even at this age, they're going to get into the years of driving vehicles at 16 and have responsibilities placed on them. And as you see, they usually have a growth spurt at this age group. Girls finish usually by 16 years, boys by 18 years of age. The reproduction system in the males is development takes place. Voice starts to change. Menstrual cycles begin, which is called menarche in females, and of course they start going through their acne, facial, and they actually are very, very conscious of their appearance. Of course, adolescence is a period of time which is when they start developing conflicts within the family, where they think they know everything. Privacy becomes an issue. If you run on a patient at this age group, they do not want their clothes cut off, even if they're injured. And privacy of their body is very, and to rephrase, basically their privacy is very self-conscious, and they are really aware about their appearance. You know, this is the time of life when females start wearing makeup, shaving their legs, doing everything that mother does. And of course, they struggle to create their own identity. They want to get out in the world and make a name for themselves. You could see this in athletics a lot, where you're the star football player, or in females, you're the star basketball player or the star lead cheerleader, or they're trying to create their own identity as they develop. And as you can see, peer pressure comes into play big time with this age group. They have more leniency about going out, going down to the local rec room, and or just running around in the mall. I think mall is one of the big places now. You'll see these kids in groups going around, and peer pressure is a big deal. This is where they get influenced by others. Come on, let's smoke a little cigarettes, and it may even include illicit drug use. And of course, at this age group, they're experiencing a lot in sex, and most of the times they are not prepared for the sex, so a lot of times it's unprotected sex, and this is the time in their lives where they can actually conceive a child, and this is when you're going to have teenage pregnancies. Sometimes there are eating disorders, especially on rejections. If somebody is being rejected, a lot of times they will basically go out and use food as a comforter. A code of ethics developed. Usually you'll see this in a lot of your students or a lot of your preteens, where they develop codes of ethics. And of course, a lot of your kids at this age group have high risk of suicide and depressed, especially if they are rejected by a peer or a group of peers. Early adulthood. This is one of the great times of life. 19 to 40 years of age is considered early adulthood. Vital signs are basically do not vary at all, usually 60 to 100 beats per minute on their heart rate, and the respiratory rate is 12 to 20 breaths per minute, which is normal for an adult, and the systolic blood pressure is 90 to 140 millimeters of mercury. As you can see, in early adulthood, this is basically a more stable period of life. This is where people start settling down, have families, get married. Their life usually centers more around their family, their work. Of course, this is a stressful period because at this time of life, especially in the early part of adulthood, is basically that they want what mom and dad has, and this is where the stress comes into play, where they get financially burdened, and their credit history and all this comes into play, and they want to settle down and have everything mom and dad has. They also develop lifelong habits at this time, and their family is important to them. Middle age adults. Basically, this is a very stable time of life, 40 to 60 years of age. As you can see, their vitals are still basically the same as in the early adult, where their pulse is 60 over to 100 and respiratory rates 12 to 20. And their systolic blood pressure is usually around 90 to 140. This is also a state in life where people start having some health issues as far as hypertension and other pulmonary diseases, COPD, especially if they were a smoker when they were younger. This is also a time where you'll start seeing people start wearing glasses. They're hearing loss, especially in the male population, where they work in a factory where there is a large noise, which can affect or damage the ears. This is also an age where cancer becomes evident. Menopause occurs in the late 40s to early 50s. It depends on the patient when it starts, but it can cause night sweats and things of that nature. Diabetes and hypertension and weight problems, which I already talked about, hypertension. These things start coming into play. Usually your diabetes at this age is usually a type 2 diabetes, which is basically where a person becomes overweight and their pancreas does not secrete enough insulin to combat the sugar intake. Exercise and health diets can diminish a lot of the effect of aging. I know this for a fact. Exercise and a healthy diet can keep your body weight, body mass weight down, and it can increase your activity in life. If you become large and can't exercise, these will diminish your process of aging. Also in the middle-aged adult, focused on achieving life goals are usually established. Lifestyles of the children leaving home are also come into play. Basically, a lot of times depends on the when their children had children. Also have a lifestyle of grandchildren at this time. They usually have a physical, emotion, and spiritual reserves are handled all life issues. They can take care of themselves. They've already been to the adolescent age and the young adult age where they realize that they can relieve a lot of stress by taking care of things. This also the last component of this last slide is aging parents. This is usually where you're aging the adult, middle-aged adult is starting to taking their mother or their father to the hospital or to the doctor's appointments, or even taking away the aging parents' cars. Sometimes this can be stressful. So as you can see, at this age we have to take care of children, grandchildren, and aging parents, and sometimes this can be very stressful, and but we usually can handle it pretty good. Older adults, 61 years and older, that ranges a bunch on basically on the genetics of the patient, plus the health style that they selected in life. If they are active, they are going to advance in life further. But as you can see, the life expectancy is basically 78 years old. I seen a deal on the other day. One of the doctors were on a talk show, and life expectancy is going up. It's now in the 80s to 90 years of age. So as you can see, with the medication and the constant hospitals, the improvement on cardiovascular surgeries and replacement of heart replacements and all these can extend a patient's life with advance in all types of medication. And we'll talk about that when we get into pharmacology, about the medications people take to control their blood pressures, control their cholesterols. All these come as a factor as the patient gets older. And as I was talking in the last slide, overall health, medication taken, and medical condition of the patient really helps with a person's life expectancy, due to the fact that we can actually have a medical condition and it can be controlled by multiple medications. That's one of the problems that we have in the field, is when we arrive on scene on these patients, we need to always make sure that we get all their medications that they're taking so we can take them to the hospital, making sure that we don't have any contraindication of different medications in the field or at the hospital. Somebody may be on blood thinners, which for cardiovascular problems, or they may be taking insulin by injection, or even medication to control their diabetes oral intake. So we need to make sure that we collect all their medications as we are on scene and take them to the hospital with us. A lot of your geriatrics already have a list established, and they will have it present when you arrive on scene. And of course, their vital signs are going to depend on their age. A lot of these patients take hypertension medication. Cinepril is a common medication for hypertension. Basically, we do not want them to have a blood pressure in the over 150 to, I've seen it up 190s to 200, which is basically placing that patient in a stroke category. The small vessels in the brain can also rupture due to the hypertension. So there are numerous medications out there. There are different kinds to control hypertension, but hypertension is a major problem in diabetes. As we was talking about earlier, as far as the older adult, you'll see some cardiovascular problems develop as they get older. Atherosclerosis basically is a hardening of the arteries, that the vascular system becomes stiff, and they do not expand and contract as well to control blood pressure, and cardiac output decreases, and the ability to replace the blood cells, which comes from the bone marrow, is one of the major components of our replacement, declines, as does blood volume. So basically, as we get older, the heart starts to wear out. You got to realize it's been pumping in the chest for many, many years at a very constant rate. So it starts to wear out, starts to get hard. Vascular system becomes stiff, and as you can see, it will decrease people's blood pressures because you don't have the cardiac output, and the heart itself does not have the strength. Also, there is a deal where the heart becomes hypertrophic, which means it starts to develop larger muscles inside the heart, which reduces the heart chamber, and this is also one of the reasons why cardiac output is decreased. Also, the respiratory system becomes a problem as they get older, especially with people that smoked. COPD, chronic obstructive pulmonary disease is what it means, COPD. You'll hear that a lot. Emphysema, a lot of these come into play. The size of the airway increases, and the surface of the alveoli, which you probably haven't covered yet, the surface of the alveoli. Alveoli are little tiny air sacs, and there's millions and millions of them inside the lung, which act as a transfer of oxygen gases across into the capillary bed that actually rejuvenates the blood with oxygenated blood to the left side of the heart. Of course, the natural elasticity of the lungs decreases, and they become more attuned to using the intercostal muscles or other accessory muscles to help them breathe. Breathing becomes more labor intensified, and as you can see, somebody that's having a hard time breathing, they use up a lot of energy and they just become tired and can't breathe adequately. Also, there is a component on the alveoli that help keep the air sacs open, which is called surfactant, which is just basically a component inside the lungs that attach and adhere to the alveoli to help keep the airway sacs open. This also diminishes as they become older. And as you can tell at this age, there is a lot more mucus buildup, and aspiration obstruction of the airway becomes more likely. By the age of 75, the vital capacity of the lungs are only 50% of a younger adult's vital capacity. So as you can see, that is a greatly reduction in capacity of the lungs. The respiratory muscle mass is decreased, increased stiffness of the thoracic cage. Everything starts to become more stiff as far as the breathing of the muscles of the respiratory system. Decreased surface area available around the exchange of gas, what we talked about, the alveoli, and residual volume increases. When we're talking about residual volume is the air that is left inside the lung after a exhalation or breathing out, and this volume increases, and we'll talk more about that in our lessons in class when we go to respiratory. The endocrine system is basically your system that your hormones and your pancreas all come into play here. This is basically where you're going to see insulin drop off. A patient was normally a diabetic may become one. Your metabolism decreases. In other words, the adrenal glands, which sit on top of your kidneys, reduce in function. People just basically tend to slow down their physical activity, and basically they a lot of times decrease their food intake, and a lot of times this is just due to the fact that as they get older into the geriatric stage, food just not tastes like it used to. Of course, their reproductive system changed to some extent, not always. As you can see in the reproduction part, they are still able to produce sperm, but the penis does not actually become rigid enough for intercourse and decreases over time. Women usually have a decrease in size of the uterus and the vagina, plus also during menopause they have a destruction of the vagina wall itself, which makes intercourse sometimes very painful. Hormones produced for the sexual components of the body usually decrease, and sexual desire may diminish but does not cease. There are some active geriatrics that are still having sex daily. As I told you earlier in one of the other slides, taste and sensation of their eating becomes less sensitive, and the food just does not taste good to them. Their salival secretion decreases, and this is also a component of their digestive tract. Ability for the intestines to contract and move food out. This is one of the big deals. A lot of times you'll see in geriatrics where they are doing things for their gastrointestinal system, as far as one day they're constipated, one day they have diarrhea, so they go and take X-Lax for their constipation, then the next day they're taking another medication to stop it. So it's also, a lot of times it is a constant battle, and the problem with this, especially with atherosclerosis, when they go to the commode to defecate, a lot of times they are actually putting a lot of pressure on their aortic arch and their vessels, and they can actually, even in their brain, and can cause pressure, increase the pressure as they try to defecate. Gallstones become more increasingly common, not always. Anal sphincter changes can produce fecal incontinence. In other words, they have a anal leakage. The renal system, basically this is the kidneys and the ureter and the urethra, basically, especially in males. A lot of times the prostate causes a problem as far as being able to get rid of the waste, to actually urinate. Kidney masses decrease in size, and they reduction in filtration of our fluid in our body. Remember, kidneys are also one of the major components that control our blood pressure by getting rid of excess fluid, and its ability to clear waste from the body, and the ability to conserve fluids when needed. So as you can see, the renal system comes into a big play in our body, and as we get older it declines in its ability to do its job. And as you know, if you've been around a lot of geriatric patients, or a lot of geriatric population like your grandparents or something, you'll see that their motor and sensory network becomes slower. They move slower. They just basically don't want to cause a fall due to their ability to balance. Neurons are lost, but there's usually not a loss of knowledge or skill. Just remember, another deal about geriatric is the brain actually shrinks, and there's a lot of more area for the brain to actually be injured in a motor vehicle accident due to the coup contra coup of the brain bouncing around inside the cranial vault. A lot of times their sleep pattern changes, not always. And as you can see, the age-related shrinkage created the voids inside the brain by the example, and as you can see, the brain has more area to actually move around, and veins can be stretched and severed inside the cranial vault, which could lead up to a hemorrhagic stroke. And as you can see, we're talking about the nervous system right now. The reaction time and the sensation of something, as a young adult, you touch something hot, it's a quick reaction to pull your hand away from that heat. It may take them several more seconds to realize that, hey, that's hot, and to move their hand away, which can cause more accidents and more damage to the skin tissue. Remember, the skin is also becoming very thin as they get older. Increase in reaction time slows. A lot of times the slowing down in reflexes causes falls, and this contributes to trauma. Just remember, always examine your patient as a medical patient. Why did you fall? Did you become dizzy? So basically, it could be a medical condition secondary to a trauma. Most older adults can see and hear well, so don't always go into a room and start talking real loud, because a lot of times they will correct you and say, I can hear just fine. So evaluate your patient as far as their hearing ability before you start screaming at them. A lot of times they will have glasses or hearing aids. You can see those. Some visual distortion can be common, and hearing loss is 4 times more common than vision loss. This is a true fact. Basically, especially I feel like in your geriatric adult male, hearing loss is more a problem than it is in the female. That's my own opinion. It's not in the book, but due to the fact that a lot of your males worked in a factory during their lifetime, or in a large noisy environment that causes them to have hearing damage due to the large amount of noise in that area. According to statistics, 5 years before death, most people retain their high brain function where they can evaluate everything. Just a common thing that associated with my father before he died. He could do mathematics as well as anybody, and he was 84 years old on the time of his death, but he was very good at brain functions as far as things that he was really familiar with. But the deal is, statistically, 95% of your elderly live alone. They've lost a spouse or a loved one in their life, and they tend to have a large amount of elderly that live alone by themselves. Financial limitations may restrict access to health or care or medication. This is a growing problem. A lot of people are on Social Security, a minimum Social Security, or Medicaid, Medicare, whatever. But sometimes they have to decide whether they're going to eat or whether they're going to take their medication or buy their medication for the month. So there is a problem out there, and a lot of times it's going to be the food that they suggest that they take, and then you're going to be called for a medical condition because they're not compliant with their medication. This is a saying that more than 50% of single women in the United States who are 60 years of age or older are living at or below the poverty line, and that is true. Not always, but they do have to combat, just like I said, whether they're going to eat or whether they're going to buy their medication. Elderly need to face their own mortality. Usually, if they're of a Christian faith or a religious faith, they usually are ready to go, and sometimes that is a common deal. Isolation depression can be a challenge because I have seen this for a fact in nursing facilities where a family has just dropped their loved one off or their elderly adult off, and they visit them maybe once or twice a year. Isolation and depression at that can be very challenging for these older adults. There are 10 review questions at the end of this lecture, so you may want to go and take these review questions. They're not going to be graded or anything, but it might give you a helping hand as far as understanding some of this.